75 years ago, the world knew little about cerebral palsy or how to treat it. People with CP were cared for by family doctors or private physicians. There was no funding, no services to speak of, and many children were placed in institutions. In 1945, after a small group of concerned parents met at Queens General Hospital, the first program for children with cerebral palsy was held at the Department of Health in Manhattan. Parent groups were forming throughout the state around this time, and in 1946 they came together in Albany to form the Cerebral Palsy Associations of New York State. By the time we entered the 1950s, CP of New York had 24 affiliates. This wasn't just the beginning of services for people with CP, it was the beginning of a powerful movement driven by parents, families, and volunteers. During this time, there was little regulation of services, and almost no government funding. In 1964, the New York State Elks Association and CP of New York State established the Home Service Program, designed to benefit children and adults with disabilities and their families. The Elks adopted the Home Service Program as its major project and have continued to fund it for almost 60 years. In 1965, President Lyndon Johnson signed legislation to create Medicare and Medicaid, and by the 1970s, Medicaid funding became available to support people with disabilities. With this funding, the movement was beginning to make significant strides. The decade that followed was one of great change.
What we need is a new approach. We have to change the way we care for our mentally retarded. We ask for change, we demand change. What you've seen here just doesn't have to be this way.
CP of New York State, this small coordinating organization with only a handful of employees, became instrumental in the deinstitutionalization process. The historic Willowbrook Decree, signed by then New York Governor Hugh Carey, was the start of a partnership between the federal and state governments and not-for-profit organizations such as CP of New York and our affiliates. The CP family's leadership set into motion a movement that has helped provide opportunities for people with disabilities to reach goals once deemed impossible. In 1978, the Office of Mental Retardation and Developmental Disabilities, now known as the Office for People with Developmental Disabilities, was created due to the need for an independent state agency to implement the Willowbrook Consent Decree. With its creation came more change, and the movement took another step forward. CP of New York State and our affiliates continued to grow over time as government looked more and more to private agencies for community housing opportunities and other programs. With this growth, our world became more complex. And again, CP of New York adjusted our strategies and way of looking at our service system. Affiliates built and expanded clinics and grew their preschool, school-age, early intervention, respite, and family support programs. We had done a very good job of building on the movement our founding volunteers began, and we were successful in many respects in staying focused on and fulfilling our mission. The disability movement also faced more oversight and fewer funds. And today, families are concerned that a lack of awareness and a lack of support from state government will cause history to repeat itself. That we're headed back to the beginning, looking for vital resources. We are in the midst of a workforce crisis, challenged in our ability to recruit and retain direct support professionals, teachers' aides, and other critical staff. Advocacy has become more important than ever, and CP has been at the forefront of organizing and mobilizing agencies through statewide coalitions like COPA and NIDA. We have increased collaboration to save resources and share best practices. We partner with families, volunteers, and community leaders to advocate. And we are working with government officials to make sure we have a say in shaping the future of the field. And we will do this so that we can reaffirm our shared commitment to fulfill the mission that was started more than 75 years ago, to provide quality supports and services for people with disabilities and their families. We are the Cerebral Palsy Associations of New York State. We have the wisdom of our rich history, the determination to tackle what's in front of us right here and right now, and the perseverance to move together toward tomorrow.